Hello everyone and good morning. I'm Janice Peterson from SBS World News. I'm your Master of Ceremonies today. In a virtual way, we're doing things a bit differently this year. It's my great pleasure and privilege to be with you here once again as we celebrate Multicultural Health Week 2020. I'd like to begin by acknowledging the traditional owners of the land on which we meet today, certainly where I am, this beautiful patch of Sydney, and where you are too. Thanks again for joining us. On behalf of all of us, I'd like to extend my respects to elders past, present and emerging. Before we proceed further with the program, just a bit of housekeeping. After today's speakers, we will have time for questions from our online audience, and a big hello to everyone tuning in. We're so thrilled that you can join us. It's a pretty easy process. Just simply submit your questions using the Q&A function. Now, throughout this morning's session, we really encourage you to share your comments and your posts with the Multicultural Health Week hashtag. There it is in front of you. That's hashtag Multicultural Health Week 20 on the New South Wales Multicultural Health Communication Service, or MHCS, Facebook and Twitter pages. So please get amongst it. We want you to get engaged, be involved. You really need to be talking about this to our friends, to our families, to our communities, and get the message out there. So be mindful of that. The hashtag Multicultural Health Week 20. And a reminder to everyone that we are recording this session. It'll be available for viewing on the Multicultural Health Week 2020 website from Wednesday. So do check it out and keep an eye out for that. Now, to start today's Multicultural Health Week event, please join me in watching a video kindly provided by Elizabeth Koff, Secretary for New South Wales Health, who will officially launch the week.
Good morning, everyone. It's a great honour to deliver this message today to launch Multicultural Health Week for 2020. I would like to thank you all for attending this important event and expressly thank our special guests. Multicultural Health Week is a reminder to New South Wales Health Services and culturally and linguistically diverse communities of the importance of providing equitable access to information and resources to Australians whose first language may not be English. I would like to congratulate the New South Wales Multicultural Health Communication Service, or much easier, MHCS, for coordinating this year's Multicultural Health Week, together with the Multicultural Health Services and the Pillars. I would like to especially commend this year's Multicultural Health Week Advisory Committee for proudly showcasing the theme Health Literacy and Safer Use of Medicines. This year has been a challenging one for us all, and nobody has been not impacted by the pandemic. We all work together to ensure our families, friends and loved ones are all safe. The theme is particularly important during this time. The week highlights the safe use of medicines and also the role your pharmacist has in supporting your health and safe use of medicines. The resources developed by Multicultural Health will be available in close to 30 languages and will be available online for everyone to share with their communities. These resources showcase that we are working towards ensuring we are delivering the initiatives highlighted in the New South Wales Plan for Healthy, Culturally and Linguistically Diverse Communities, which aims to meet the health needs of culturally and linguistically diverse consumers. The plan aims to ensure that people of culturally and linguistically diverse backgrounds have equitable access to healthcare services that are culturally responsive, safe and of the highest quality. I also want to commend Multicultural Health Week Steering Committee for their expertise and guidance. This committee includes representatives from New South Wales Health, the statewide multicultural services, healthcare interpreter services, the Clinical Excellence Commission, the National Prescribing Service and the New South Wales Refugee Health Service. I also want to thank the Special Broadcasting Service for their collaboration for Multicultural Health Week, as well as the other partner organisations who have helped bring a focus to health literacy and safe use of medicine for multicultural communities. I would also like to thank our health professionals and health services across New South Wales that provide culturally responsive, high-quality care to our communities. And of course, I would like to also thank the media who are always supportive in sharing health messages to their audiences. It is my pleasure now to officially launch Multicultural Health Week for 2020. Thank you.
Wonderful, Elizabeth. A huge thank you to Elizabeth Koch. She's been such a champion of Multicultural Health Week and all the causes attached to it. So thank you so much for that very warm welcome and launch of Multicultural Health Week 2020. Multicultural Health Week is, of course, an event celebrated right across our state every year. It showcases the importance of diversity through language and culture in health services. This initiative also provides an important platform to raise the important health issues faced by multicultural communities, not just in this great state of ours, but indeed all over the country. It's now been 10 years that New South Wales Multicultural Health Communication Service has been successfully coordinating Multicultural Health Week on behalf of New South Wales Health. And they do that in collaboration with the multicultural health services right across local health districts. Now this year, the theme is health literacy and the safe use of medicines. As Elizabeth pointed out, it's such an important area for all of us. So we're going to hear from experts and consumers in discussing the importance of this theme, and we'll launch a range of multilingual resources. I'd like to now introduce our next speaker, Lisa Woodland, to talk about the new resources developed for multicultural communities on the theme of safe use of medicines. Lisa is Director, New South Wales Multicultural Health Communication Service and Manager for Priority Populations at the South Eastern Sydney Local Health District. Lisa has extensive experience in building the capacity of health services to deliver culturally responsive and inclusive care. She's led a broad range of research, health promotion and service development projects aimed at really improving the access to health services, experience of care and health outcomes to vulnerable populations. Ladies and gentlemen, please welcome Lisa Woodland.
Thank you very much, Janice. I would also like to start by acknowledging the traditional owners of the lands on which we're meeting today. I'm joining you from Gadigal land, which is part of the Eora Nation. I'd like to pay my respects to elders past, present and emerging, and extend that respect to our Aboriginal colleagues who are joining us today. I'd also like to pay my respects to people from migrant and refugee backgrounds who have come from all over the world to make Australia their home and to contribute to our very rich and successful multicultural society. So each September, New South Wales Health celebrates Multicultural Health Week. It's an opportunity to focus on the health needs of multicultural communities and how we as a health system can respond to those needs. So as you've heard, this year's theme is health literacy and the safe use of medicines. It's an important reminder to the community to talk to their pharmacist or their doctor if they have any questions about their medicines. It is also an important reminder to health professionals to ensure that patients understand how to take their medicines safely. Safe use of medicines is particularly important for people from culturally and linguistically diverse backgrounds who may not speak English well, may be unfamiliar with the Australian healthcare system, or may come from countries that have very different practices and regulations around medicines. We know from evidence that people from culturally and linguistically diverse backgrounds are at high risk of making mistakes in taking their medicines and of being hospitalised for complications for those medicines. We also know from consultations with our key stakeholders that people from culturally and linguistically diverse backgrounds often find information related to their medicines very complex and overwhelming, and that there is a lack of translated resources to support the safe use of medicines. In some communities, there are also cultural practices around sharing medicines with others. Key messages this Multicultural Health Week are ensuring you know what your medicine is for, how to take your medicine safely, the active ingredient in your medicine, and that the packaging of medicines that are the same may in fact look different. This year we've developed a number of multilingual resources to support people's safe use of medicines. We've developed a 1-minute broadcast quality video which highlights the importance of talking with your pharmacist about your medicines, and that's available in 7 languages. And we also have radio ads available in those 7 languages. We'll show this video later on in this session. We've also developed some written resources. We'll just bring those up onto the screen. So we have a 1-page fact sheet which addresses frequently asked questions about using medicines safely. And I'm very thrilled to say that this is available in 29 languages. And alongside these, we also have social media posts, which are available in 26 languages. These resources are free and are available to download from the Multicultural Health website. I'm also pleased to inform you of a new patient fact sheet, which is being launched by the Cancer Institute of New South Wales EviQ program. And we'll just bring that up on the screen for you now too. Thanks. For those of you who are not familiar with EviQ, it is a free resource that supports health professionals in the delivery of cancer treatments. It includes a range of fact sheets for patients, their families and carers about specific cancer treatments and common side effects. So it's my great pleasure to announce the launch of the EviQ's latest fact sheet, Chemotherapy Safety at Home, during Multicultural Health Week 2020. The resource reflects the theme of Multicultural Health Week by providing simple information on safety and precautions when being treated with chemotherapy at home. The fact sheet is available in 11 languages. The fact sheets and other resources are a testament to the Cancer Institute of New South Wales' ongoing commitment to improving cancer outcomes for multicultural communities. This year's Multicultural Health Week has been a great team effort, and I'd like to sincerely thank all the multicultural health staff who joined us in the workshop in March to explore the issues related to the safe use of medicines in culturally and linguistically diverse communities. I would also like to thank the very active and committed members of our steering committee who guided the development of the resources that we're launching today. We were very fortunate in having terrific representation from across New South Wales, including from the Ministry of Health, Nick Sandraco and Nishta Vivedi, from the New South Wales Managers Health Forum, Kathy Butler, from the New South Wales Refugee Health Service, Lydia Sestakova, from New South Wales Health Translation Service, Eva Melham, from Sydney Children's Hospital Network, Dushyanthi Nagaratam, from the Clinical Excellence Commission, Nina Marcello, from the National Prescribing Service, Gemma Gonzalez and Matthew Harris, from the School of Pharmacy, University of Sydney, Professor Parisa Aslani, and from the Multicultural Health Communications Service, Jess Halaretne and Sam Shen. We're also joined by 2 consumer representatives who provided valuable insights and advice. Vijay Dayanathan and Kanita Ahmed. We're very honoured to have two of our committee members as speakers at today's launch. Lastly, I would like to sincerely thank the Health and Social Policy Branch of the Ministry of Health for funding Multicultural Health Week and for their ongoing support of the work of the New South Wales Multicultural Health Communication Service. So thank you very much. I hope you enjoyed today's session, and back to you, Janice.
I have to get a bit faster at unmuting myself, but a huge thank you to you, Lisa, and your dedicated team at MHCS for your efforts in ensuring Multicultural Health Week continues to deliver innovative programs and resources to support better health outcomes for our multicultural communities. And just a reminder, friends, that if you do have questions for Lisa or for our upcoming speakers, it's a simple process. Please just type them into the Q&A function as you go, and we will have time to speak to our speakers at the end of this and answer some of those questions a little later in the session. So thinking caps on, if you have any questions in regard to this year's theme, we'd love to hear them. It's now my great pleasure to introduce Professor Parisa Aslani. Professor Aslani is Professor in Medicine's Use Optimisation at the University of Sydney School of Pharmacy. She's been a researcher and educator in the field of consumer medicine information and adherence for the past 25 years now, and her goal is to improve quality use of medicines by patients and consumers. Folks, she knows this area inside out, and we cannot wait to learn more. So please join me in welcoming Parisa.
Thank you, everyone. I'm just about to share my slides. Okay, great. Thank you. I'd like to acknowledge also the traditional owners of the land on which we are meeting today. I'm joining from the land of the Darug people. I'd like to pay my respects to elders past, present and emerging, and also extend my respects to all colleagues who've joined in today from the various cultures that you represent. It's a great pleasure to participate in the Multicultural Health Week, and I would like to take this opportunity to thank the organisers for inviting me to speak today. Australia is one of the most multicultural societies on earth, and an article by the McKell Institute just under 2 years ago stated that Australia is the world's most successful multicultural society. So as a nation, we continue with our efforts to ensure that we remain successful, and today you'll be hearing about the work in the health area that's being done to ensure that we remain a successful multicultural society. What I'm planning to cover in the next 15 minutes or so is really around patient safety, medication or medicine safety, which is a component of patient safety, focusing on safe use of medicines and recognizing the active ingredient, health literacy, and some strategies that we can use to help with people's safe use of medicines. So coming back to the key themes of the Multicultural Health Week, just to remind you that really the focus is around what's the medicine for, how do you take it safely, what's in the medicine, and how can we tell from the packaging that that's the correct medicine we're taking. Just to remind you or let you know about our National Medicines Policy, which has been around for the last 20 years. But the National Medicines Policy really underpins the work that we're doing around safe use of medicines. There are 4 pillars or 4 objectives to our National Medicines Policy, and at the heart is the healthy consumer. So all the objectives work towards ensuring that we have healthy consumers. And the goal of quality use of medicines by patients or people, if they're purchasing over-the-counter medications, is a focus of the National Medicines Policy and therefore underpins the Multicultural Health Week. If we move on to patient safety and look at some of the issues around patient safety, and that would kind of help set the scene for why we have these messages for the Multicultural Health Week. Patient safety is defined as the absence of preventable harm to a patient during the process of healthcare and the reduction of risk of unnecessary harm. In other words, patients should not be harmed when they're taking medicines that's been prescribed to them, or they're buying over the counter, or when they're receiving healthcare services. That's not always the case. The WHO tells us that millions of patients are harmed each year due to unsafe healthcare. 2.6 million deaths occur annually in low and middle income countries. And the most detrimental errors are related to misdiagnosis, prescription errors, or incorrect use of medicines. And medication errors alone can cost about $42 billion worth globally annually. So there are some serious issues there around patient safety. A couple of reports from the Pharmaceutical Society of Australia have put the focus on medicine safety in Australia, both within the community and healthcare system, the hospital system, as well as within aged care. And some of the data pertinent to Australia are that about 250,000 hospital admissions annually are as a result of medication-related problems. And this is costing $1.4 billion a year. About 400,000 end up going to emergency departments because of medication-related problems, and half of this is actually preventable. And 1.2 million Australians are experiencing adverse medication events in the 6 months prior. So you can see that the evidence is strong to say that we really do need to think about medication use and appropriate use of medications. And medication safety has become so important that it's now in the 10th National Health Medicine Priority. But if we look at what is kind of medicine safety, well, it focuses primarily around errors and medication-related harm, where errors are any kind of preventable error that may cause or lead to an appropriate medication use or harm while the person is taking their medication, or medication-related harm, which is around any kind of preventable drug event, adversible drug event, or non-preventable adverse drug event. So anything really around medication use can fall into these issues here. But how can we help in terms of patient safety and medicine safety? Because these are real problems. And so the healthcare professionals and the healthcare system have to take these seriously. But to address this, we've got to think about one of the risk factors for errors for unsafe use of medicines. And one factor that significantly influences safe use of medicines is health literacy. Health literacy is really around someone's ability to find health-related information, navigate the healthcare system, then understand that information that they have received, be able to appraise the information, and act on that information. So health literacy is literacy specific to health and medicines. Health literacy can be divided into several levels, but really the basic or functional health literacy is what we need in order to be able to look after our own health in terms of selecting medicines over the counter, finding information that's relevant around safe use of medicines, and be able to act on that information. Communicative or interactive health literacy is a higher level of health literacy, and that's often something people need if they are doing more complicated health-related activities, such as being able to measure their blood sugar levels, if they're diabetic, knowing what that level means, and then being able to adjust their insulin. While critical health literacy is the highest level. And for that, we need much more advanced cognitive and literacy skills together with that social skills so that we can actually critically analyze information. And that's pertinent for people who want to be involved in shared decision-making with their healthcare professionals. But really, basic or functional health literacy is what we need in order to be able to just self-manage. But based on ABS data, about 60% of the Australian population have very poor or marginal health literacy. And the ABS concluded that about half of the Australians don't have the minimum level of literacy for coping with increasing demands, not only based on this poor health literacy, but also poor numeracy and literacy skills that are all needed and that feed into the health literacy. So on average, if you think about it, you're looking at 6 out of 10 people that will have problems with basic or functional health literacy. So problems in reading labels, knowing how to act on a prescription label or an over-the-counter medication label, understanding what the medicine's name is, and so on. So it's kind of a high risk factor when you think about it. So health literacy is important in terms of what healthcare professionals can do in helping towards safe use of medicines. Now, health literacy has been shown extensively in the literature to impact health. People with poor or low health literacy tend to access the healthcare system less. They have poorer relationships with their healthcare professionals. They tend to ask less questions. They're worse in terms of self-care and self-management, and consequently their health outcomes tend to be worse, especially with adherence to medication. They're less adherent and so poorer health outcomes. So all in all, low or poor health literacy has negative impacts on people's health, and that can be as simple as accessing the healthcare system to the higher end clinical and health outcomes. And what ABS also showed is that people with lower health literacy tended to have all of these characteristics outlined here, but specifically it was linked with people from a non-English speaking background, I guess within the context of English being as our first language used in Australia. So those from multicultural backgrounds where English is limited tend to be at risk of having lower health literacy levels and therefore at risk of having poorer health outcomes. And what the literature points to is this group of people who should be targeted when it comes to safe use of medicines, improving health literacy and improving health outcomes. Our elderly, within Australia, those from a non-English speaking background, persons with lower education and persons with chronic disease. So you can see why Multicultural Health Week has the focus of health literacy and safe use of medicines. But what can we do? What can we focus on and what should be our goals? So if I take you back to the original messages for this year's Multicultural Health Week, to know about what your medicine is for, it's around getting an understanding about medicine name and medicine purpose. So those are things that should be highlighted to people who are taking prescription or over-the-counter medications. How to take their medication safely, so focusing on dosage instructions and focusing on a way that the message is clear and can be understood and acted on by people. Then the active ingredient comes back again to the medicine name and what's in your medicine. So letting people know what is an active ingredient and how's that different to the name, the brand name or the generic brand. And I can come to that in a minute. And obviously packaging of medicines, which can be confusing, but if we focus on the medicine name, the active ingredient, then it's more likely that people will be able to focus on that rather than the actual packaging in identifying their medications. So what can we do? I'm not sure where that clapping is coming from, but it sounded really good. So Hippocrates said that the chief virtue that language can have is clearness, and nothing detracts it from so much as the use of unfamiliar words. So this I'd like to use to stress the importance of using clear and understandable language, because people with poorer or low health literacy will have difficulty in understanding information being provided if it's unfamiliar, if it's jargon, or if it's said in a way that is unclear. So if we go to strategies and we think about the medicine name and so on, here's an example of a prescription medication label. So you can see that the active ingredient appears in a couple of spots. It's the first on the actual prescription medication label, and it's the second on the product. So highlighting what is the active ingredient and explaining that the active ingredient is the medicine that actually causes the impact or is what's needed would make it clear for people to understand that this is their medicine. So pantoprazole in this case is the medicine. This is what they're taking. But that all medicines have brand names that are specific to the pharmaceutical company. And in this case, the brand name is highlighted up here, pantoprazole Sandoz. and down here, pantoprazole sandols. And that's the brand name. But in this case, I've given you an example of a generic brand, a less expensive version of the active ingredient pantoprazole. There are other examples, so another brand name for pantoprazole would be something like Somac. So you can see that there are information on the actual medication to highlight to the person what's the active ingredient, the drug, what works in their body, what acts in their body, and what's the brand name, which is specific to the company. And in this case, the generic brand is the brand name here. And this would be the less expensive version. And then the next thing is the instructions. So the instructions here are what might appear to be fairly clear because it's one tablet to be taken in, once a day. But for some people that can actually be confusing. Do I take it in the morning? Do I take it at lunchtime? Do I take it in the evening? So when do I take it? And to make that easier for people to understand with low health literacy is to link it to a specific time of the day so it's easier for people to remember. Take it in the morning, half an hour before breakfast. So giving that kind of advice. When it comes to giving more information that people want, in Australia we've got consumer medicines information, which is detailed information about medicines, prescription and pharmacist-only medicines available for anyone who's on that medication. It can be accessed from websites, etc., from the pharmacist, from the GP. And last year, TGA put out a simplified template to make sure that the information that pharmaceutical companies are putting together is in a way that people can understand who are from low health literacy backgrounds. So the design is easier, the language is easier. And here, again, there is information around the brand name, which is this one here, and the active ingredient, which is the smaller name underneath. So it talks about the medicine name and the brand of the medicine. And then there's information about why people are taking this medicine. So what use is it for, as well as other information that's necessary to help with safe use of medicines. Information, however, is the most critical strategy for improving health literacy. And it's not just about giving information, but it's also ensuring that that information is provided in a way that people understand. So in providing information, it's important to know the English language level of that person. Are interpreters needed? Because most people get their information from healthcare professionals. And so healthcare professionals should figure out, do I need an interpreter? And what's the health literacy level of this person? And, at what level should I be providing that information? People from a multicultural background tend to rely heavily on their social network. So often they get information from friends and family. So ensuring that there are awareness campaigns, such as this campaign, and other ways of raising awareness, not only for individuals, but for the community, will help ensure that much more consistent information is being provided. Now, for healthcare professionals, verbal information is the easiest to provide, but that information should really be supported by written information, because people have the opportunity then to go back, think about it, read that information, and ask questions if need be. So educating and not just informing is important. And as part of that, healthcare professionals should use a method like a teach-back method, for example, where they provide information, they should really assess whether that person has understood that information by asking them either to demonstrate, say if it's a product that needs to be demonstrated like an asthma inhaler, or to tell them exactly how they'll be taking their medication, putting it in the context of their daily activities, for example. So making sure that the information they've provided has been understood and that that person can actually act on that information. So really helping in trying to improve health literacy requires using easy to understand language, trying to use interpreters as much as possible, supporting verbal information with written information that people can read in their own time, and then ensuring that the information that's been provided has been understood and can be acted on by the person. And also to bear in mind that when information is being provided, whilst there might be lots of leaflets with nice pictures, etc., it's got to be culturally and linguistically appropriate for people to notice it and then want to use that information. So in summary, patient harm due to medicines is a serious issue, and it does happen quite a bit. And in particular, medicine errors and medication-related harm occurs. And a lot of it boils down to unsafe use of medicines, which may be due to people's lack of understanding of how to use medicines, what they're taking, doubling up on doses, or even sharing medications. But educating people importantly around what their medicine is, so what's the active ingredient, what brand that they got, how to take that medicine, what's it doing for them, as well as if they've got any issues or any problems or any side effects, to let their doctor or pharmacist know, are critical steps to ensure safe use of medicines. Involving the patient and engaging them in their own care means that they become more responsible in their self-care and are more likely to use their medications correctly. So we need to ensure that we're focusing on those that are vulnerable, whether it's low health literacy, low English skills, elderly, etc., to ensure that they're correctly using their medicines. And I'll just leave you with this final quote, which I thought from a multicultural perspective: "He who has health has hope, and he who has hope has everything." Thank you.
Well, a huge thank you, Farisa, for your valuable insights and for highlighting just how important it is for all of us to work together to support multicultural communities in the safe use of medicines. He who has hope has everything. It's a lovely, optimistic way to end your talk. So thanks again, Professor Aslani. Another quick reminder to our wonderful online audience that if you do have any questions for Farisa, any of the speakers today, you know the drill. It's easy, just type them into the Q&A function and we'll get to them a little bit later. It's now my great pleasure to introduce to you a wonderful colleague of Multicultural Health Communication Service, someone who will present the perspective of healthcare consumers from culturally diverse backgrounds. Kanita Ahmed is a cultural support worker with the Central and Eastern Sydney Cultural Support Program based in Sydney Local Health District. Kanita works in partnership with health professionals to coordinate in-language mindfulness programs with the Bangladeshi community and also to coordinate women's health forums for multicultural communities. I know her as a true creative. Her talents are many and varied and wide, but we can get into that a little later too. Kanita, I might put you on the spot of what else you do, but she's so passionate about her work. Both Kanita and Lisa, I'm very, very happy to say, both starred in a news story which ran last night. I was lucky enough to introduce it on SBS World News last night, about this very topic, the safe use of medicines and everything about Multicultural Health Week 2020. Ladies and gentlemen, please welcome Kanita Ahmed.
Thank you, Dennis. Hi, I'm honored to be here to speak about the multicultural, how to use medicine safely as the healthcare consumer and the launch of Multicultural Health Week 2020. Now, when we say 2020 is actually deeply connected with our health condition because of the ongoing coronavirus infection disease, commonly known as COVID-19. So there are, we were thinking think if there were any specific vaccine or medication to prevent this virus or to cure us, how wonderful that would be. Yes, the very word medicine, whenever we think about medicine, we think about hope, health, cure, strength, besides its taste, color, form, how it is. However, everyone uses medicine, but using it safely depends on how well we know our medicine. To know our medicine better, we need to know our medicine better, we need to know its active ingredient. It's to follow the instructions on the label, to know how to use the dosage, the side effects, the strength, and the amount of medicine supplied to us. I can tell also in this case, the keeping track of our medicine list or keeping track of our medicine also helps. And in case of any question or any confusion or before stopping any medicine, it is always good to talk to our pharmacist or our doctor regarding that medicine. And most importantly, we should not practice sharing our medicine, because it should be completely stopped to share medicine with others. Firstly, as a healthcare consumer and as a pharmacist being in Bangladesh and pharmacy technician and consumer in Australia, I can tell one thing is straight, that safe use of medicine is, I have seen more in Australia than anywhere else, because the unique healthcare system of Australia, and also the medicines are scheduling here. So the scheduling of medicine controls the availability of medicine to us, and it's beautiful and wonderful consumer service towards us as well. And we have also seen, when we come to a new country, we face lots of challenges. The first challenge is when we want to get access to the healthcare system of that country. For that country, we don't speak the language, which is the local language of that country. So when the language is not our first language, I meant, in that case, we face lots of trouble and difficulties. At the same time, we try to cope with the new rules and regulations of that country, and also the other things like staying away from the family, the new land, and everything is considered here. We have stigma even to go and talk to the public and ask for things because of the language barrier. Lots of things count. So we have also seen, when we come to a country, we have also seen that there are lots of few new terms for us. For example, we see that prescription medicine, then pharmacy only medicine, pharmacist only medicine, and maybe we can see that brand medicine, generic medicine, lots of new terms for us. So these are really difficult for us to understand to start with. And also I can tell, for the same medical conditions, different countries have got different terms. And in this regard, I can tell you a story. While I stay in the pharmacy, I have seen pregnant women came to the pharmacy and asked our pharmacist for gastric medicine. Now, our pharmacist looked very confused, because when she was struggling to explain what is her discomfort and how she is feeling with her gestures and broken language. So I was just looking at them for a bit far, and seeing her, she looked very familiar with her dress code. So I approached her, and because I was very familiar with the word gastric, what does it mean? It means heartburn in Australia, and which for her, being her pregnant and other gestures, my pharmacist thought she's talking about nausea. Now let's get back to the other terms. I was talking about brand medicine and generic medicine. At this point, we get really confused when we get the prescription from the doctor and we take it to the pharmacist, and the pharmacist asks us what type of medicine I want, an expensive one or a cheaper one, which has got the same active ingredient and works better. Well, as consumer, I can tell we don't understand brand or generic good, I mean more better, but we know if something is cheap, the quality will not match the real one. So in that case, the brand medicine, we prefer the brand medicine instead of the generic one. Also, the other term I said, little bit of knowledge to us, like information, why those categories are pharmacy, pharmacist, or prescription only medicines, could help us to know our medicine better. The final one, and the most important one I would like to say, is we always know sharing is caring, but it is just the opposite in regards to medicine. It is caring when it's not sharing. Actually, we share with a good intention as an act of caring, and we don't pay attention to that it could be an unsafe act. Also, we don't take the active, we don't take the side effects into consideration, that medicine may affect to individuals depending on their own medical conditions. In this regard, I can tell how I have witnessed sharing medicine was not only unsafe but also dangerous ones. So my neighbor shared her aspirin medicine with her sister, who was suffering with a fever and the pain. So she gave her the aspirin to reduce her fever and pain. But actually she was suffering from dengue hemorrhagic fever, and she was not aware that aspirin or ibuprofen type of medicine are contraindicated for dengue fever. So as a result, what happened, that aggravated her bleeding, and we ended up going to the hospital that night. So I can tell sharing is not only unsafe, at some point this could be really dangerous as well. So to remember to use our medicine safely, I would like to say three things, because there are so many, but three main things are: first one, to look for the opportunities in countries like Australia, where there is where we can gain access to the healthcare system. Especially Australia has every kind of support to its consumers, especially the interpreter to support with language, to our pharmacists and doctors are very helpful to discuss everything with us whenever we have a question or confusion or anything. And secondly, I would say to know our medicine well. What is the active ingredient actually? Because sometimes we get confused because the medicine looks different, the packaging looks different. So in that case, if we are aware of the active ingredient, at least we would know that we are taking the right medicine. And thirdly, and most importantly, not to share our medicine with anyone. And again, with the hope, I would like to say, we will get through this global pandemic together. Stay strong, stay safe, and also maintain good hygiene, following good hygiene and social distancing. Thank you all. Thank you, everyone.
Lovely, Kanita. Thank you so much again for sharing your journey and experiences with us this morning. And I'm sure after hearing from our two fabulous speakers, our audience must have a lot of questions. So a reminder just to submit your questions to Lisa, Parisa, or Kanita, the three speakers, through the Q&A function, as I know some of you have already done. Well, now I'd like to hand it over to Lisa to facilitate our Q&A session. Lisa, are you ready to take that on?
I certainly am.
Wonderful.
Thanks to Kanita and Parisa for those fantastic presentations. I think that you brought so much richness to our session today with that really important information. We do have some questions that have come through the Q&A function, and also some comments. So before we start, I'd just like to read one of the comments that's come through, which is relevant to all my multicultural health colleagues. So apologies if I have to turn away to read it, but I just think it was a lovely comment that I'd like to share with you. Multicultural health officers and staff have been brilliant in these complex times. I would like to thank and acknowledge their commitment and dedication. Our diverse communities are so appreciative of all your efforts. So thank you for that comment. For all my colleagues out there, I think that's it's lovely to have that feedback from the community. So a few questions have come through, some for me, some for Parisa and for Kanita. So I might take the first one. There's a question about how we decided the languages to make the resources available in. And I mean, this is an important consideration for all communication that we have with multicultural communities. As you're aware, we have many languages represented across New South Wales. For these particular resources, we focused on the most frequently spoken languages. For the video resources, and for the written resources, we replicated that, but also focused on languages of new and emerging communities. And we really understand that these communities have very little access to translated resources. So in this work and other work that we do, we always try and prioritise those new and emerging languages, and of course languages of refugee communities. So a few other questions that have come through. Parisa, I might ask you to answer this one. We know that the health literacy survey was conducted some time ago. That was in 2006. Just wondering, a question around, is there some updated information since that survey around health literacy?
To be honest, the best and the most comprehensive survey was the 2006 one. And since then, there has been a health survey. And what I'm going to do is take the liberty of actually sharing a screen to show you what I'm referring to. But the information is still being referred to the 2006 one. So I'm about to share a screen so I can show, and then you can actually look at the website in more detail. So this is the Australian Government's Australian Institute of Health and Welfare website, and they did a further survey in 2018. And yet when they still report on the health literacy, it still goes back to the 2006 data. So there's a lot more up-to-date information here. But broadly, the 2006 was the more comprehensive one. And when you look at the data in more detail, it's still very similar to the 2006 information. So they're still quoting the 41%, or what I referred to as was the other way around, the 60%. So the information there and much more detail can be found in there. So unfortunately, we haven't got any more up-to-date and comprehensive than the 2006 one.
Thank you very much, Parisa. The next question is for you, Kenita. What can family members and carers do to support people in the safe use of medicines?
Come again, please.
So the question is, what can family members and carers do to support people in the safe use of medicines?
Oh, of course. Yes, it's a good question to ask. Actually, in this case, firstly, if the carer or the family members are looking after children, then they would do they will look at all the safety measures, because the children are not allowed to handle medicine themselves. So they will do everything for them, like dosage, reading the label to make them understand, giving it on time, and every other thing. If the patients are now everything, they will look after. They will assist the children or the minor while taking medicine. And if it is for an elderly patient, then again they have to go with the same way. They will look after the elderly and also, of course, when they should tell the elderly people when they take the medicine to switch on their lights to remember. And sometimes they can get it done when some elderly takes multiple medicines, and the pharmacists, what they do, they can make a Webster pack for them, so they would know which medicine, what time they need to take. I mean, as a carer or family members, we need to take full responsibility when they are not able to take care of themselves, especially elderly and children and others. As being a responsible person, they should also know and understand their medicine by talking to their pharmacist or doctor, and also know how well to use their medicine, when to take, how much to take, what not to double up, like all these things. So this is how a carer can help for the elderly and all, and also an individual can help themselves this way, or our family members.
Great. Thanks very much, Kenita. Parisa, another question for you. We know that being discharged from hospital is a critical time for patients in the safe use of medicines. And what can health professionals do to assist during this time?
Lots, absolutely lots. The transitions of care is one of the more critical stages in the patient's journey, where they're likely to forget a lot of information they've been taught or any changes that has occurred. So what healthcare professionals can do, be it the nurse, the pharmacist, any community healthcare workers, anyone who's involved in that transition of care, is to educate the person, give information to the person and their carers, if there are carers, around any changes in medications that may have occurred in the hospital, any changes in the brands of the medications that may have occurred, making sure that the person understands what medicines they're taking, what are they taking it for. Also, if there's any self-care or self-management issues that have to be considered, but remembering that that person may be quite overwhelmed and they may not be able to take in all that information. So following it up, even if contacting them within 48 hours, and then a few days after, if it's possible, if resources allow, but also getting the same information out to their GP and out to their local pharmacy, so that everyone is on the same page and can look after the patient at best. But the transitions of care are critical, because not only does the person have to be able to understand all the changes that have happened, but they also have to be in a state where they can take on board that information. And so social networks, their carers, their healthcare professional team, they all have to be involved, and it's really important to follow those people up if resources allow. There's a lot of readmissions that happen within a short period following discharge, and so by educating and following up, we can probably reduce that.
Thanks very much, Parisa. There's a question here around health professionals who don't assist patients with interpreters. I might just answer that and then throw to you as well, Parisa, if you've got anything to add. Just to make sure that everybody's aware that interpreters are free within the public health care system, and consumers can actually request an interpreter. The other thing to remember is that there is a free doctor's priority line that's available through the Commonwealth Translating and Interpreting Service, and this is also a free service to community pharmacists as well. So it's really important for us to not only make sure that the health professionals are aware of this, but also consumers, so that they can ask for an interpreter to assist them in the communication. Anything that you'd like to add to that, Parisa?
Thank you, Lisa. I think one of the issues is lack of awareness. I think there may be quite a few healthcare professionals that aren't aware of interpreter services or where to access those. And often in a busy environment, they might feel that they may not get quick access to someone when they need it. So informing and increasing their awareness is also one of the barriers that has to be dealt with. And often people rely on family members for interpreting, which is not appropriate in all cases. So I think if we can make it more accessible and increase awareness, that would help somewhat. And often in some pharmacies, they might actually have bilinguals, which would be helpful if it's appropriate language. But it's around what's out there, what can we access and what can we use to help people.
Great, thanks, Parisa. Sam, there's a question again that's come through for me, so maybe if you could spotlight me and I can address that. Thanks. So there's some questions and comments that have come particularly in relation to communicating with culturally and linguistically diverse communities around COVID-19, and we know that this has been an issue that's been in the media, and obviously a very important thing. Just in terms of what we're doing here in New South Wales, just to make everybody aware, I think we have now over 900 resources related to COVID-19 for multicultural communities in over 50 languages. The approach that we take in New South Wales is a little bit different to some of the approaches taken in other jurisdictions. We really support the use of co-designed processes where we work with communities to make sure that the information that we're providing is relevant and meaningful to them, and responds to the questions and the needs within the communities. With the written resources that we have, we disseminate those through multicultural networks to try and make sure that we reach as many people as possible. And of course, we're really aware that written resources are just one part of the way that we need to communicate into communities, and we have produced many audio visual resources so that to make the information accessible to a whole range of communities. So again, we use trusted sources to make these videos, bilingual community educators, health professionals, and community leaders to deliver those messages to communities. And obviously this is a very sort of challenging time. There's rapidly changing information, and sometimes we are a little bit, we take our time to make sure that the information is translated accurately and is culturally relevant. But we have been working very hard in New South Wales Health to make sure that we reach out to multicultural communities. And there's a fantastic article for those of you that saw it on SBS World News last night about the pop-up clinic in southwestern Sydney at the Laotian Temple and the resources for the community there. So just a little bit of information for those of you that have been asking about that. So we'll go back to the questions that have come through. Parisa, a question for you. There's a question that's particular to sort of mental health. Are there any sort of issues that are related to medicines for mental health conditions?
I guess it depends what is meant by the issues. I mean, as an example, people who have depression have been shown to be poorer in terms of adhering to their medication for conditions other than depression, if they've got, multiple conditions. It doesn't necessarily make anyone worse in terms of health literacy, so that's not necessarily like a factor that contributes. So it's different issues around mental health that can affect different clinical outcomes and can be very specific to the condition the person has. And if it's a child or an adult or an elderly, and is the primary condition or as a consequence of another multi-morbidity. So there's a lot of things there. So I'm not there's nothing specific that I can say at this stage. It just depends on what the focus of that question is. But I'd say if someone is, having mental health issues, then it's critical that healthcare professionals are aware and offer as much support as is needed, depending on, the issue at hand.
Great. So I think we've got time for one or two more questions. Parisa, this is another one for you. How important is it to communicate all the side effects to patients taking medications with low health literacy? With the understanding that sometimes the list of side effects is quite long and can produce a lot of concern for people.
I'd answer it, and I think Kanita can probably answer that as well from a perspective of a pharmacist too. But in terms of communicating all side effects, I think it'll be an exhausting communication scenario if you had to tell someone all of their side effects. My advice is to think about what are the more pertinent side effects. So what's a very common one and perhaps a serious one depending on that medication. And so advising not just what's a likely and a common side effect that could happen, but what should a person do about that side effect? I think that's more important. People may get anxious if they are aware of some serious side effects that could happen, but the evidence actually shows if you inform people appropriately about side effects, you're increasing their awareness. And if they know what to act, how to act on it, it's actually a better impact. So, for example, if it's an antibiotic, a common side effect is going to be gastro. They're likely to get maybe a bit of nausea, some diarrhea. So it's important to advise people about that, and then what should happen depending on how severe the side effect is. But if that particular medication has a very rare side effect, the chance of getting that is very low and it's not a serious side effect, you probably don't want to take up your counselling time and give them that information when they first get the medication. You can support your counselling with written information and they can read that later. But always let them know if there's anything that they don't understand, instead of stopping the medication, to either contact the pharmacist or the doctor so they can check that information. So give them the action that they have to do as well.
Great. Thanks, Teresa. Kanisha, is there anything that you would like to add to that around issues of side effects?
Not really. She has covered all of it.
Great. All right. We do have lots of other questions on the Q&A function. And what we will do is we'll answer those in writing for those of you who still have had your questions unanswered. Thank you very much for sending your questions in. It's really important that we have the opportunity to discuss these issues, and thank you again to Teresa and Kanisha for answering those. So back to you, Janice.
Thank you so much, Lisa, and thanks to our panellists for generously taking on those questions. And a huge thank you to everyone online for submitting those thoughtful questions. I think we really hashed out some more details there. So that's very much appreciated from all of us. And I just love seeing so many people engaged, because that's what we have to do. We have to talk about these issues and get the message out there. It's now my great pleasure to introduce a 1-minute video that's been produced for Multicultural Health Week 2020. Now, this video was developed as a partnership between Multicultural Health Communication Service and my fabulous broadcaster, SBS, your favourite TV channel, I hope. And it highlights the importance of talking to your pharmacist about your medicines. So let's check it out.
This year, Multicultural Health Week highlights the safe use of medicines and the role your pharmacist has in supporting your health. Did you know that you can speak with your pharmacist about your medicines? Your pharmacist is a highly trained professional and is there to help you. They can discuss what your medicine is for, how to take your medicine safely, what the active ingredient in your medicine is, and why the packaging of medicines that are the same look different. The active ingredient is what makes your medicine work. Your medicine can often be made by more than one company and have different brand names. Each has the same active ingredient and works in the same way. Your pharmacist might offer you one that saves you money.
And the effect is the same?
Absolutely the same.
Well, in that case, I'll go with the generic brand.
No worries, okay.
Thank you so much.
Your health and safety matters. If you have any questions, speak to your doctor or pharmacist.
So that was really great. Approachable, informative, absolutely packed with vital health advice. And I think, as Professor Aslani said, we need this sort of message to be very simple and clear. So I found that really direct and, as I say, approachable. So hopefully lots of people can take that advice on board. Please, ladies and gentlemen, make use of it, share it with your colleagues, your communities, your family. It's a really exceptional resource and it's available in 7 languages, which can be downloaded from the Multicultural Health Week 2020 website. So do check it out, along with some fact sheets, and they're available in 29 languages. So lots and lots of people should be able to take advantage of these incredible resources. Congratulations to everyone involved in the development of those resources. It's been a really wonderful partnership between Multicultural Health Week Steering Committee members and SBS. A big, big thank you to the Multicultural Health Service at Northern Sydney Local Health District and South Eastern Sydney Local Health District, the Translation Service at Western Sydney Local Health District, and New South Wales Refugee Health Service for contributing to the number of languages in which these resources will be available. It's just so important. Thank you. It's now my great pleasure to introduce Dr. Marianne Gale to provide some closing remarks to today's session. I'd like to tell you just a tiny bit about this woman. Dr. Marianne Gale is Director of Population and Community Health at South Eastern Sydney Local Health District. She's also worked as New South Wales Ministry of Health Acting Director, Strategy and Performance in the Centre for Population Health, as well as a medical advisor in the Office of the Chief Health Officer. What's more, she's also had a lot of hands-on experience. So prior to that work, she was working for Médecins Sans Frontières as a field doctor and a medical advisor. She's very, very experienced. We're delighted to have her with us today. Welcome, Marianne.
Thank you so much, Janice, and hello, everybody. Look, I think it's been a fascinating session so far, and it's a great chance to really take the time to focus on this important issue for all of our community, but in particular for our multicultural communities. And a special thank you on behalf of all the participants to the guest speakers, Professor Aslani and Ms. Kanita Ahmed, for your fantastic, insightful and very practical presentations. I think, as you both highlighted, the safe use of medicines is such an important part of actually keeping our communities healthy and out of hospital. And ultimately, I think we all agree that that's what we want for ourselves, for our families, and for our community. You know, health is something we take for granted, but you really notice its absence when we do have illnesses. And getting sick and ending up in hospital, for many of us at different points of our life, will become inevitable and something that we cannot avoid. But where we can avoid it, we should definitely try to do that. And taking medicines where that's recommended by our doctor or our pharmacist is a really important part of keeping ourselves, our families, our communities happy, healthy, and out of hospital. I think Professor Aslani showed us some really compelling data about what inappropriate or unsafe use of medicines, what impact that has upon us as individuals, but also as a society, as a health system, and not only the individual harms that we have as a result of that, but also the high cost for our society when medicines are not used safely. And both our guest speakers highlighted the really important role that both individuals and families and communities play, as well as health professionals and the health system. So some of the really important roles of individuals is about understanding the information about medicines, understanding how to read labels, making sure that we take note of the active ingredient in any medicine that we're taking, making sure that we don't share our medicines with families and friends. When we think about health professionals and the health system, there are some important things also that we need to ensure, such as for people who are not confident in English, that we do make sure they have access to interpreters, that we employ the teach-back method that Professor Aslani outlined to make sure to check back with patients that they have understood the instruction that's been given to them, and to make sure that people are given the opportunity of having written information as well, so that they can read it and also share it with family members and others who may be able to support them. During COVID, it's particularly highlighted the importance for our communities to discuss with and consult with and be supported by health professionals. GPs are there, our pharmacists are there, And I know that many in our community feel a bit unsafe going out and a bit concerned and may think that healthcare settings are unsafe settings, but that's not the case. All our health settings, including pharmacies and GPs, have many measures in place to be COVID safe. And it's really important at this time that people, especially those with chronic health conditions, continue to see their health practitioners. So as we come to the close of this event, I'd like to say a few thank yous. So firstly, thank you to all of you for attending the online launch today. And I would strongly encourage all of you who are viewing this event to think about how we can each play our role to support the safe use of medicines. So I'd encourage all of you in your respective roles to think about how you might distribute the resources that have been launched today, how you may share that with the people and the communities that you work with. For those health professionals on the line, to think about how you might employ that mechanism of teach back and how you could embed that in your daily practice to try and make sure that patients understand how to take medicines safely. And for all of us, I think for ourselves, for our families, communities, and for our patients, to really encourage people to talk to their doctor and their pharmacist if they have any questions about their medicines, because there are many supports out there for people. I'd like to say a big thank you to Multicultural Health Services, interpreter services and translation services across all local health districts for their ongoing collaboration around Multicultural Health Week. It's a really important opportunity to reflect on the key role that they play in keeping people from culturally and linguistically diverse communities healthy across our state of New South Wales. I'd like to say a big thank you to the team at the New South Wales Multicultural Health Communication Service for all their efforts in organising this launch and for developing some really terrific multilingual resources to support the safe use of medicines. In particular, a big thank you to Sam Shen, Senior Project Officer, who's done a tremendous job in coordinating this event and the development of the resources. So thank you, Sam. I also want to acknowledge all the hard work of Jess Halaratne, the Deputy Director, for all the work that she's done to make sure that these important messages for our community get out there through our colleagues in the media so that people can really hear and absorb these important messages. And finally, a big thank you to SBS for partnering with us in Multicultural Health Week to produce some fabulous and much needed resources. And a special thank you to Janice Peterson, who has been a wonderful MC today and such a dedicated supporter of Multicultural Health Week for many years. So thank you. And on that note, back to you, Janice. Thanks.
Thanks so much, Dr. Gale. That was just a lovely chat, a lovely talk you've given there to wrap things up here. And friends, that does bring us to the end of today's session. Just a reminder that all of the resources that you've seen today, the videos, including the recording of this very event, will be available to download for free this week by visiting the Multicultural Health Week 2020 website. So keep an eye out for that. We also invite you to like the Multicultural Health Communication Service Facebook and Twitter pages. I know they've been active already. Look out for that hashtag Multicultural Health Week 20. And come on board, please help us promote Multicultural Health Week messages with your networks. Thanks again to Dr. Marianne Gale and all of the speakers today. Please also tune in to SBS World News Online. That's SBS On Demand. As Lisa mentioned, as I've talked up already, we had the news report last night. I was lucky enough to introduce us, so I was very, very happy to be on board. So we ran the story last night. It featured Lisa, it featured Kanita as well, and it really helped to boost our message about the safe use of medicine. So check it out on SBS On Demand. A huge thank you to all of our media partners for your continuous support. Without you, all our key health messages would not reach communities. So we are truly grateful for your ongoing support. And thanks to you for watching, for being a part of this very special event. We did a little bit differently this year, but we were so thankful to have you on board. And if you're watching on catch up later on, we thank you for tuning in as well. On behalf of the organisers, a big and happy Multicultural Health Week 2020. Thanks for joining us.